You're watching Living Well on WMBD.
If you are experiencing joint pain and haven't taken a fall or had some other injury, you might think you have arthritis. But how do you know for sure? Orthopedic surgeon Dr. Richard Driessnack joins us now to help us understand. Welcome to Living Well.
Thank you.
Let's start with the definition. How do we define arthritis? What is it?
Well, arthritis technically is a loss of cartilage in joints that move, and the cartilage or the bearing surface is that smooth tissue that makes the joints move without pain. Loss of cartilage is defined as arthritis, and that can lead to stiffness and pain and swelling in your joints.
What causes it?
Well, there are a number of causes of arthritis. I'll hit the big three. First of all, genetics. Your heredity has a lot to do with the way your joints work, and we can't really choose our parents. We get who we get, and so I tell a lot of people if they have a strong family history of arthritis, that's likely a contributing factor to why their knees or hips or shoulders hurt. However, there are some structural things. If people are knock-kneed or bow-legged, have dysplasia of the hip, which you may have heard of, those are mechanical reasons that lead to premature wear of cartilage. So the things that you can't control are your genetics and hereditary factors, and that's one major factor. The second major cause is inflammatory conditions. Inflammatory conditions can be either infections in the joints or they can be things like rheumatoid arthritis, which are more autoimmune system inflammatory things. So probably less common, but still a major factor. And then the third big category really is trauma. And trauma can have various phases to it. It can be as obvious as you break your bone. It involves your hip or knee or other major joint, and the irregularity can lead to a rough surface and premature loss of cartilage. But ligament injuries sustained by a lot of athletes, meniscus or cartilage tears, anything that involves a joint can lead to subsequent deterioration. And the final thing in that category that I really think is crucial is weight, obesity. And I think in this country, in our country today, obesity is a form of trauma, cumulative trauma, just too much pressure on the joint that leads to premature wear.
So when we hear athletes, I'm going to back you up just a little bit, when we hear athletes talk about, I played basketball for years or volleyball for years and now my knees are shot. Is that because of the excessive wear and tear caused by the game, or could they have had some of those biomechanical difficulties that you talked about, and maybe they played their sport with an improperly placed joint?
Well, I would say if an athlete plays without having an injury in his career and develops arthritis, that probably is a hereditary predisposition to having arthritis, so probably a stronger family history. But if you have a definite injury and you can identify a point in time where you hurt your knee, for example, then that probably is a more strong contributing factor.
So how do we prevent arthritis if we can?
Well, odd as it seems, exercise is a major beneficial thing that we can do.
I love to hear that.
To prevent arthritis. Walking, low impact type of activities are very helpful. And then keeping your muscles strong. So many people that I see with arthritis, I send to physical therapy for strengthening, and it definitely helps, and they're always amazed. They're skeptical initially, but they're amazed, and they come back and they say, you know, it really helped my pain. And then obviously controlling weight, eating well, good nutrition, exercise, controlling your calories, and trying to curb the obesity epidemic is really the best things that we can do to prevent it.
Some wonderful advice, and I would imagine if you do have arthritis that you need to consult with your medical practitioner to figure out how you live well through that issue.
Yes.
Dr. Driessnack, thank you so much for being with us on Living Well. Some great advice.
You're welcome.
Coming up, a pet accidentally sent around the world returns home.